Have we been on yet?
Okay, thank you everybody for telling us that we have been on mute this entire time. I pressed this one button and a blue light went on, so I thought that we were ready to go. So I really apologize about that. So it must just be a sleepy Friday afternoon here, so thank you. So we can start again. You missed all of our wonderful introductions, but we'll go ahead and just quickly introduce ourselves again. So thank you for speaking up. So welcome to the Title X Gag Rule, implications for sexual violence survivors and action steps for advocates. So thank you so much for joining us. And we'll just go ahead and we'll get started. So my name is Ashley Sturz-Griffith. I am the Advocacy Support Specialist at the Minnesota Coalition Against Sexual Assault. So what I do is I provide technical assistance to advocates. And when I say the words technical assistance, what I basically mean is that I provide support and I help advocates work through challenges. Some of the ways that I do that are that I'm available by phone or email if you all need to chat. I also conduct site visits, so I can go out to your locations and meet with you. And you can also stop by here as well. I connect advocates with others, and I also dig up recommended practices. So I'm a person that can do that to assist you. I also conduct trainings and webinars. I conduct our legal advocacy trainings. We have 2 of those every year. I help with the symposium, which is our annual training event. And I also facilitate our Train the Trainer event, which is a training for folks who are conducting the 40-hour training. I set up regional meetings too, and like I said before, I conduct site visits. A little bit about my background. Previous to working at the Minnesota Coalition Against Sexual Assault, I was in direct services. I was a legal advocate for victim survivors of sexual assault. And previous to that, I worked in a shelter setting with victim survivors. I also worked as part of a multidisciplinary team at a children's advocacy center too. And I will go ahead and have Leah introduce herself.
Hi, everyone. This is Leah Montgomery. I am the Director of Government Affairs and Health Finance at Planned Parenthood of Minnesota, North Dakota, and South Dakota. Thanks so much to MNCASA for inviting me to come and talk to you all about Title X and the gag rule and the implications for sexual assault survivors here in Minnesota. So my title, as I said, is the Director of Government Affairs and Health Finance. And what that essentially means is that I am our chief lobbyist here in Minnesota. So I'm at the Capitol working on issues related to reproductive health care and healthcare in general. And I'm also our health policy expert at Planned Parenthood. And just a quick note that at Planned Parenthood, we have a couple of different organizational structures that are under our umbrella, hence the 2 logos at the top of my title. We have our 501c3 organization, which is our tax-exempt nonprofit, which is most likely how all of you are also structured. Our 501c3 operates our health centers, our education programs, and the majority of our internal activities. But we also have a 501c4 organization, which is the pink logo up there, our Action Fund. And that is allows us to be a politically active nonprofit. Our C4 works to elect candidates and endorse candidates. I will say that both of our entities, our C3 and our C4, can educate the public and elected officials on reproductive health care issues. But our C4 can do additional activities such as distribute voting records of elected officials, endorse candidates, etc. So as an FYI, all the information that I'll be giving in today's discussion is C3 allowable, and but I did just want to note that there are some actions that if you have any questions about whether it's allowable under your C3, you should just discuss that internally. But thank you very much for having me. I really appreciate the invitation.
Cool. Thank you, Leah. So let's get to know you. There is a chat function on Zoom that you can chat in your name and your title. So I'll have you go ahead and do that so we can get a feel of who is attending. And when you do chat in the chat function, there's this little drop down function too that says either you can select all panelists or you can select all panelists and attendees. And we would like you to select all panelists and attendees so everybody can see what you are chatting. All right. So just some of the logistics today. Right now, all phone lines are muted. To unmute your line, you will press *7, and we will unmute all lines at the end of today's session to hear from you. So there will be kind of a Q&A section at the end where we can hear your voice and talk to you. In the meantime, you can submit questions via the chat bar. And we can go ahead and address those. If you just want to submit a question to the panelists, which are the folks here talking to you, you can click on that function and we can address your question. Otherwise, if you want all folks to see it, again, go to the all panelists and attendees function. So if you, to keep your line muted until you want to make, or we'll have you keep your line muted until you want to make or comment or ask a question. And to mute your line when you are done, you would press *6. And this webinar will be recorded and we'll make this link available as well too. So thank you. All right. So thank you all for chatting in where your names and your titles. We see we have folks from across the state here, so that's good to see, and from different programs as well. So what we're going to do now is we're going to launch a poll, and this is just to get us kind of thinking about and get our head in this space of reproductive health. So what I would like to know is, do you talk to your clients about reproductive health? I'm going to launch this poll and we're going to have it up for just a little bit here. So if you could go ahead and click yes, no, or if you're unsure, you can click that too. I'll give you about 30 seconds. All right, so we're getting our answers here. Just a couple more seconds. All right, we got an 89% success or participation rate. So thank you all. Oh, I'm sorry. Can you cast that one more time? I apologize. All right, now I will press the correct button. Thank you. So let's see here. Do you talk with your clients about reproductive health? So it looks like most folks do, but we do have about the same amount that do not, and some folks are unsure. So, you know, this is kind of a hard topic to talk about, and today we hope to really dive in and think about how this really does affect victim survivors of sexual violence and how it is important to incorporate in advocacy. And it also is very linked, so I'm not surprised to see that many of you are talking about with your clients about this subject too. So thank you for taking that. Okay, so the reason that we're all here today is that we are going to learn how the Title X Gag Rule affects sexual violence survivors. And we'll also list action steps for advocates. So when we walk away today, there are going to be 5 things that you can do in regards to this Title X Gag Rule. Today, we have an agenda for today, so we're spending some time right now doing some introductions. Leah is then going to discuss Planned Parenthood, and she's also going to outline what Title X is, as well as what the gag rule is. I will spend some time discussing the implications that the Title X gag rule will have for victim survivors of sexual violence. We'll also talk about the action steps that you can take. And lastly, we will leave room for questions. And before we begin, I do just want to note that a lot of folks have strong feelings about abortion, and a large part of the gag rule is a response to abortion. So we will be discussing this subject matter today. Just a reminder, something that we all know, advocates we're here to provide options regardless of our personal feelings of abortion. We do know abortion is an option for those who may be experiencing sexual violence. Another thing, Leah spent some time talking about the differences between a 501c3 and a 501c4. And just bring this back to us. So today we are going to be talking about what we consider advocacy with a capital A. So what we think of as cause advocacy instead of case advocacy. So many advocates, many of the folks on the line, you may be doing case advocacy. So in your day-to-day work, you may be working to meet the needs of an individual victim survivor in the context of maybe housing or healthcare or the criminal justice system and more. But in regards to case advocacy, what we're talking about today, some advocates may become uncomfortable because there are some limitations to what can be done due to how your organization is funded and due to your tax status. But what you should all know is that, as a person in this world, there are many things that you can do in regards to cause advocacy. And that's, when you're off the clock, there are many things that you can do. In regards to your professional time, I would encourage you to take this information back to your organization and have conversations about how you as an organization want to be responding to this urgent issue. All right. Leah, I'll have you take it away.
Thanks, Ashley. So this is Leah Montgomery again, and I just wanted to start off with a really quick overview of Planned Parenthood in our region. So for nearly 90 years, Planned Parenthood, Minnesota, North Dakota, South Dakota has proudly served the heart of the Midwest. We are the leading provider of reproductive health care, a trusted source for evidence-based sexuality education, and a fearless voice on behalf of women's rights in our region. So PPMNS, which is our acronym for our affiliate, has 19 clinics in 2 states. 18 of our clinics are in Minnesota, and we have 1 clinic in Sioux Falls, South Dakota. And we also have 1 public affairs and education outreach office in Fargo, North Dakota. In Minnesota, of our 18 clinics, 10 of them are located in greater Minnesota, as you see on the map. 5 of them are located in the suburbs, and 3 of them are located in Minneapolis, St. Paul. Half of our clinics are located in rural or medically underserved areas of Minnesota, where people may otherwise have difficulty accessing primary care. The 67,000 patients we see every year come from all walks of life, with insurance and without insurance, and come for reasons ranging from new beginnings in their life and new relationships, or just simply to be smart about their reproductive health care. 1 in 5 women in Minnesota and across the country relies on Planned Parenthood for confidential expert reproductive health care. The majority of our patients say that they consider us their primary source of care. And so what I mean by that is they consider us their primary care provider, and that we may be the only healthcare provider in their life. I know when I was in my 20s, reproductive health care was my only healthcare need. And on that point, our average patient is a woman between the ages of 20 and 30 years old. She's seeking basic family planning services. She's low income, and she will more than likely require some kind of public support to access the healthcare services she needs. So just kind of a high-level snapshot of our average patient across Minnesota.
Oops, sorry about that.
It's okay. Thank you. All right, I'll try next time. All right, and this is just a kind of snapshot of all of the services that we provide. And as I was reviewing this just this morning, I noticed I missed a couple, which I'll get into. But our clinics across Minnesota play a vital role in ensuring that Minnesotans can access critical healthcare services like birth control, life-saving cancer screenings. We do cervical and breast cancer screenings, STD testing and treatment, HIV testing and treatment, and annual exams. And for example, in 2017, we provided, Planned Parenthood clinics in Minnesota provided 160,000 units of contraception. We conducted 50,000 office visits. We administered 117,000 STD tests and distributed almost 1 million condoms just in 2017 alone. I will also just note that out of our 18 Minnesota clinics, only one provides abortion care. And I just mentioned that because there is a kind of continuous misperception that every single Planned Parenthood clinic across the country provides abortion care. And in Minnesota, again, of our 18 clinics, only one does that, and that is our St. Paul location. So the other 17 clinics across the state only provide preventive and reproductive healthcare services. And in addition to our healthcare services, we have a team of multilingual educators. And in 2017, those folks reached nearly 40,000 young people, parents, and adults through more than 1,000 educational presentations at middle schools and high schools, colleges, faith communities, cultural organizations, and parent groups. And all of our education programs are age appropriate, culturally relevant, and evidence-based. Okay, and now I'm going to move on to just a quick overview of what Title X is. I'm happy to take questions if anyone has questions about Planned Parenthood itself or any of our services. I would be happy to take those now before I get into Title X.
Yeah, and if you want to type them in, and then Leah, as you're going through Title X, if there comes to like kind of a natural break, I'll make sure to clue you in.
Sounds good.
Yeah.
Okay, so Title X is the nation's only federal grant program that is dedicated to funding comprehensive family planning services for low-income, uninsured, and underinsured Americans. So Title X was actually passed with really broad bipartisan support and signed into law by President Nixon in 1970. So this is a very long-standing, well-established grant program. And the funding under Title X enables patients to receive contraceptive care, well women exams, STI testing and treatment, and cancer screenings at low or no cost. So as you see here on the screen, Title X serves over 4 million Americans every year. The majority of those patients have incomes under what's called 100% of the federal poverty level. What that means is if you're under 100% of the federal poverty level, that means you earn less than $12,000 a year for a single person. So again, Title X is just really very vital for low-income Americans to access, again, preventive healthcare services like those listed on the screen: contraceptive care, well women exams, STI testing and treatment, and cancer screenings. And as I mentioned, Title X itself serves about 61% of all low-income women across the nation who are seeking birth control. So again, this is a really essential part of our nation's reproductive health care safety net system and enables women and men across the country to access a range of preventive care. Planned Parenthood, however, does play a really outsized role in Title X, in the Title X program. So while our clinics only represent 13% of all Title X providers across the nation, we serve 41% of those patients. So even though we don't have the majority of clinic sites across the nation, our Planned Parenthood clinics, patients are still overwhelmingly coming to us for their care and as a way to receive birth control and STD testing and treatment. However, I will say that 70% of our healthcare centers, of Planned Parenthood centers across the country, do participate in Title X. So moving to what that looks like in Minnesota. In Minnesota, there are two what are called direct grantees of the Title X program, and that is us, Planned Parenthood, Minnesota, North Dakota, South Dakota, and it is also St. Paul, Ramsey County Public Health. And both of us, both of the direct grantees have been the only direct grantees in Minnesota since Title X was created in 1971 is when the first year that we received funding. So both of these entities, us and Ramsey County Public Health, have been doing this work for about 45 years. Ramsey County operates 7 sites in and around St. Paul primarily. And I'm going to move to the next slide here. This is a map of all of the Title X sites that operate under what's called the Planned Parenthood Title X project. So on the graph, all of the clinics in pink are the Planned Parenthood Title X sites. Again, like I mentioned, of Planned Parenthood's 18 Minnesota clinics, 17 of those clinics provide Title X services. The only one that does not take Title X is our abortion clinic, well, our St. Paul clinic that happens to provide abortions, and we can discuss that later, but all the rest of our clinics do. We also then have what are called sub-delegate agencies underneath Planned Parenthood that also provide Title X, and those locations are noted here on the map. So our sub-delegates include SEMCAC in Winona, and that is they operate a family planning clinic in Winona. SMOC, which stands for the Southwestern Minnesota Opportunity Council. They're in southwestern Minnesota and are noted in red. So those are all their family planning clinic sites. And then the Mojave-Otwa clinic sites that you see kind of in purple in sort of central and northwestern Minnesota. So all in all, Planned Parenthood, our Title X project includes the 17 Planned Parenthood clinics plus 14 delegate agency clinics for a total of 31 clinics under the Planned Parenthood Title X umbrella. So we are the only statewide clinic system taking Title X in Minnesota. I mentioned before that in a previous slide that across the nation, Planned Parenthood serves 41% of all Title X patients in the country. However, here in Minnesota, our role is even larger than that. And again, it's primarily because we operate so many clinics across the state. But here in Minnesota, Planned Parenthoods provide services to 90% of all Title X patients in the state. So specifically in 2016, of the 56,000 Title X patients in Minnesota, 52,000 of those were served by a Planned Parenthood clinic. And so this is why the Title X Gag Rule, which I will get into in a minute, but that rule will block providers who counsel, refer for, or perform abortion from participating in Title X. That's why if this gag rule goes through and Planned Parenthood is therefore blocked from participating in Title X, and if we are serving 90% of the Title X patients, there are tens of thousands of patients in Minnesota who may therefore then lose access to contraceptive care, STD testing and treatment, and a range of other healthcare services. And we'll get into the details of the gag rule a little bit later. And this next slide I just included quickly to show how much success Title X has had in Minnesota specifically. We know that for every dollar placed into a publicly funded reproductive healthcare services, that it saves $7 on the end. And this is just sort of a demonstration of that. So every year in Minnesota, $3.6 million comes into the state, and that's divided up again between Planned Parenthood and Ramsey County Public Health. But that $3.6 million in 2010 prevented over 13,000 unintended pregnancies, prevented 19 cases of cervical cancer, 25 cases of gonorrhea, and 420 cases of chlamydia. And that is a net savings to the state and federal government, and i.e. all the taxpayers, of over $93 million in 1 year. And that is primarily through other deferred costs that our Medicaid public health insurance would cover. So what I'm trying to say in this slide is a little money in prevention goes a long way and helps improve health outcomes for Minnesotans.
Yeah, thank you, Leah. That's very helpful. So now that Leah has spent some time really going through what Title X is and how it's used by Planned Parenthood, let's just take a little bit here, and if you could type in the chat function, how do you think that Title X benefits victim survivors of sexual violence? So as Leah was going through those things, like what kind of clicked in your mind as something that about Title X that would really benefit those you are working with? And so Leah's going to now go through what the gag rule is, but after that we'll return to your answers. So I'm kind of asking you to multitask a little bit here. Okay.
Oh, yeah. Okay, thank you. Hi, everyone. This is Leah again. So in June, on June 1st, actually, the Trump administration issued what's a proposed rule that we call the gag rule to the Title X program. And so the gag rule does three things, which are shown here on the screen in general. First, it will bar any healthcare provider across the nation from referring, counseling, or performing abortion. Secondly, it's going to remove a guarantee that Title X patients get all information that they need about their healthcare options. And third, it's going to impose new restrictions that are specifically designed to block care at comprehensive reproductive health care providers like Planned Parenthood. So, and I will note that past Republican presidents in the US have instituted something called the Global Gag Rule that applies these same conditions on international family planning grants, but a domestic gag rule like the one proposed here has never been implemented in the history of the gag of Title X, and would be a sharp departure from 45 years worth of Title X programming. Oops, I keep hitting the wrong button. Okay, so if the Title X gag rule goes into effect, Planned Parenthood will be blocked from serving low-income patients that would otherwise come to us again for their birth control and other and STD testing and cancer screenings. And I will just say that, and that would equate to potentially upwards of 53,000 Minnesotans who would potentially lose access to that care. And I will just say too that Title X funds do not and have never paid for abortion. As I've mentioned, I hope repeatedly, that the Title X funding only pays for preventive and reproductive healthcare services like those listed on the screen. And so I think that's kind of the irony of the gag rule, is that Title X funding does not go for abortion care. It goes for these other things on the screen. And so by preventing providers like Planned Parenthood and others from being a part of the Title X program, we're really just hurting Minnesotans who want to access these other services. The proponents of instituting a gag rule will repeatedly say that if abortion providers or Planned Parenthood or other providers are barred from the program, that there's a number of other safety networks, safety net clinics that can just absorb all of our patients. I will say, however, that that has been resoundingly dismissed by healthcare experts and by folks in Minnesota. So as you see here on the screen, Jonathan Watson, who is the CEO of the Minnesota Association of Community Health Centers, they are the umbrella organization for what are called federally qualified health centers across Minnesota. And those are the health centers that serve uninsured, undocumented, homeless populations. There are safety net clinics across Minnesota. He has repeatedly said for here in Minnesota that they are already at capacity for their what the services they can provide, and they just would not be able to absorb other patients. They of course would do their best, but they really don't have the capacity. They also don't have the statewide network of health clinics that we do, and so it would be really difficult for patients to even get to a federally qualified health center. So I just point that out so that it's clear that if we are blocked from the Title X program, it's really unclear as to where a large portion of our patients would go to receive low or no cost care. That's so critical.
Oh, what did I do? It's okay. Let's see here. All we gotta do is pop it back up. Sorry. No worries. I don't know. See.
It's so funny, I just hit the one button.
Oh, there.
I'm sorry, guys.
Oh, it's okay. Okay, we're all good to go. That's all right. Our content's good. We're just learning Zoom a little bit. Thank you, everybody, for your patience with us. Oops. And we're just going to give away all of our slides here. All right, here we go. Yeah, so earlier we asked, how do you think Title X will benefits victim survivors? We have one answer here. So STI testing and treatment, counseling, and morning after pill to prevent possibility of unintended pregnancy at low or no cost, and also privacy. So yes, these are all really important things and really crucial to victim survivors of sexual violence. And I'm glad that privacy was added too, as we're going to discuss how important privacy is, and that Planned Parenthood is especially trained and conscientious of privacy too. So now we're going to spend some time going through the implications of the Title X Gag Rule for sexual violence survivors. And as I'm going through this, I welcome you to type in the chat box if you think that I am missing anything. I have reviewed some literature and came through some experiences I've gathered, but I could be leaving some out, so I really welcome your responses. Okay. So one common theory around sexual violence is that sexual violence is rooted in power and control. So when sexual violence happens, the offender is exerting power and control over the victim survivor, and then subsequently the victim survivor loses power and control. So therefore, it's really imperative that a victim survivor has power and control over their healthcare decisions after and obviously before too experiencing sexual violence. And Title X is one way that increases a victim survivor's access to healthcare options, especially if they have other are low income or have other vulnerabilities that I will talk about. Title X also increases access for healthcare access for populations with vulnerabilities and for those who may have been traditionally oppressed. We know that vulnerability increases sexual violence. And as for oppression, some believe that oppression causes sexual violence, while others, may believe that oppression allows it to exist. So either way, no matter where you fall along those beliefs, we know that Title X serves some traditionally oppressed groups So when we look at who Title X is serving, so I have this list here of low-income individuals, folks with high deductible plans. So that's typically meaning that they're paying lower premiums. So they may be able to, afford the lower premiums, but then be stuck with high deductibles. Folks who do not have insurance, folks who are undocumented, and folks who are homeless. When I'm looking at these groups, I'm really thinking that when I was an advocate, this was a large part of my caseload were folks who were in these groups. So I think that really highlights the connection and how the gag rule will be detrimental to victim survivors of sexual violence. And so as was talked about before, the gag rule has other implications as well. So folks who may have less access to STI prevention and STI treatment, which is really crucial for somebody who's experiencing sexual violence, along with pregnancy prevention as well as abortion care. In terms of dual roles, this kind of goes back to the privacy piece. So Planned Parenthood is very conscientious and very trained in handling something like reproductive health, which is very a very private thing for many people. So if for instance, if you're living in a rural area and you've been going to this same doctor, like a pediatrician all your life, and they happen to, know your parents, they happen to be a family friend, you may not want to come to them for care about a sensitive topic, reproductive health care in general, but reproductive health care if you have experienced sexual violence, and that's, an extra sensitive topic. So like I said before, Planned Parenthood is really trained in handling these issues. For some folks, disclosing sexual violence to a healthcare professional may be, a safe option. This certainly is not for everyone. As we know, most folks may feel most comfortable disclosing to someone in their informal network, but for some victim survivors, a healthcare professional may be somebody that they trust to disclose sexual violence to. We also know that trauma has physical health effects too. So Planned Parenthood provides cancer screenings and wellness exams to really be looking at some of the physical health effects that can happen after one experiences trauma. And the gag rule has unique implications for those experiencing intimate partner sexual violence, and also for some victim survivors who may be trafficked. Some folks who are being trafficked may identify their trafficker as an intimate partner. So some of these dynamics can be similar to that sort of a situation too. So we know that it is a tactic of some abusers to coerce or force their partner to become pregnant or to become exposed to sexually transmitted infections. In regards to pregnancy, becoming pregnant and having children can create barriers for victim survivors, and these barriers can then make them more reliant on their abuser or abusive partner. So we're thinking about some barriers such as childcare, about finances, about the ways that children are used in the court system. And, a victim survivor may be afraid to lose custody and may be dragged into court processes too. So there are many, many reasons that pregnancy and having children can be a barrier or can link someone to their abusive partner. We know that negotiating sexually transmitted infection and pregnancy prevention is difficult for some folks who are experiencing intimate partner violence. I pulled these statistics from violenceagainstwomen.net. they said that 2.1 million women a year become pregnant who are experiencing intimate partner sexual violence, and 1.8 million will develop a sexually transmitted infection of those who are experiencing intimate partner violence. So this really highlights how there are barriers to negotiating these things. So it's really important that victim survivors have access and have really low barriers to accessing the healthcare services that they need. Another thing to consider is that if these free and reduced cost health services are no longer available, a victim survivor may feel the need to stay on their abusive partner's insurance, which again creates or makes them more reliant on their abusive partner. And as previously talked about, confidentiality is really important. So if we're thinking about things such as an explanation of benefits, being sent home, that's something that Planned Parenthood is really skilled at handling, and to making sure that a victim survivor is are handling things in a safe way for the victim survivor.
All right. Okay, thanks. And this is Leah again. And I'm just going to go through really quickly what is actually happening with the gag rule, just so you all get a sense of the timing of everything. So like I mentioned, a proposed rule was published on June 1st. And again, I just want to clarify that this is all happening administratively. So this is something that the executive branch, the Trump administration, just has the authority to do. This does not require an act of Congress. So this is all sort of administrative, and it's a bit wonky. So just bear with me and let me know if you have questions. So on June 1st, the proposed rule was published. We are now in a 60-day comment period where people can submit comments to the federal government about their views on this gag rule that can range from questions that they want to raise or opposition that they want to raise to the rule. So the public comment period closes on July 31st, which is just over 2 weeks away. At that time, the Federal Department of Health and Human Services, which is HHS, who are the ones who administer the Title X program, will review all of the comments. At this point, when I last checked yesterday, there was over 40,000 comments already submitted on the gag rule. So they will need to look through all those comments, and they should be formulating some type of response to the comments. Although I will say that they're under no obligation to change anything about the proposed rule based on the comments they receive. So they're just required to review them. They are going to take a couple of months, probably at least, to do that review. And what we are anticipating is sometime in as early as late August or early September, so our early fall question mark box there, we anticipate that a final rule will be issued. And then we would expect that final rule to actually go into effect probably in late October. But all of that is pretty fluid and depends on how long HHS takes to review, what kind of changes, if any, they make to a rule, and when they actually publish the rule. So all of that is very, very fluid. But again, the earliest that this could go into effect, assuming the most aggressive timeline, would be late October. And I do just want to clarify that while I have framed the implication of the gag rule in this presentation as an effect on Planned Parenthood, I do want to note that the gag rule conditions, meaning that providers cannot refer for, counsel about, or perform abortions, would apply to any provider who participates in Title X. And so every single national healthcare organization has opposed the gag rule. So everyone from the American Medical Association to the American Public Health Association to the American Congress of Obstetricians and Gynecologists, all of them have opposed this rule on the condition that it prevents medical providers from providing their patients with the full range of medical information, and that violates their standards of care. And so while this yes is certainly a swipe at Planned Parenthood, it applies to everyone. And my fear would be that Americans across the board are going to lose access to Title X because there won't be any providers who will be able to comply with the conditions because it violates their standards of care. So it is bigger than Planned Parenthood, but it certainly affects us here. So I did just want to clarify that. Okay, I'll let you do the button. Okay, so moving on to the next slide, there are some steps that you all can take, and these are all C3 friendly. So these are all things that would be allowable under your 501c3 status. These are things that we do under our 501c3 status, and these are just some ideas. But one of the biggest things that you can do is just share information about this gag rule with your colleagues, with partner organizations in your community, with friends and family, especially just through the lens that this is going to detrimentally affect access to preventive and essential reproductive health care for Minnesotans if this takes effect. Secondly, you can certainly choose to submit an official comment to the Department of Health and Human Services to express concern. And this sounds really scary, but it's not. We are happy to help you with that. There's a couple of different ways you can do that if you're interested. One is there's an actual link that you can, through the Planned Parenthood Federation of America website, that you can easily submit comments as an entity or as an individual. So I would be happy to share that link off after the webinar. If you're interested from an organizational perspective, we would be certainly happy to help you draft an official comment. We have some templates that we can share if folks are interested in doing that. The more comments we can generate, the louder we hope that HHS hears the concern and really thinks twice about issuing a final rule. The third way you can help is, if you're interested, you could write a letter to the editor to your local paper, just expressing concern with the effect of the gag rule and the implications for victim survivors of sexual assault in your community. If you're interested in this option, we, Planned Parenthood, can certainly help you with that as well. If that's something you've never done before, we would be happy to help. Fourth, we would, kind of in conjunction with the first about sharing information about the gag rule, we would love it if you can also then assure folks in your area that Planned Parenthood clinics in your area will remain open as we fight the gag rule, and that we are really committed to making sure that our 67,000 patients in the state and the 53,000 that rely on Title X continue to have the care that they need no matter what. Lastly, if you're interested, you can certainly contact your federal elected official and ask them to actively oppose the gag rule. And this is something that is allowable under your 501c3. And so that would be great. And if you have questions about who that might be or what you can say or how you contact them, again, I'm happy to help there as well. So a number of steps you can take if you're interested in regards to the Title X gag rule.
All right, so we spent some time talking about the Title X gag rule and its impacts for sexual violence survivors, and we listed the 5 action steps here. We would like to spend the remaining part of our time here answering any of your questions. So, oops, let me go back one slide here. And so we can go ahead and take some time to answer your questions. Let's see here, let me. Go ahead here. So you can either type in your questions here, or we can unmute the line pretty quick here. All right, so I'm going to allow all of you here to talk. Just one second.
business. And he told Chris, get the parts, bring the paper.
Wait a minute.
Oh, I think somebody has their line unmuted that, let's see here.
I don't know what I did here.
No questions typed in yet.
Let's see here. So we do have a question. Can this be? Oh yes, we will be we'll be sending out this recording, and then also the slides are going to be sent out as well. Because, like we said, we would like you all to be discussing this with your organizations. I'm sorry. Other.
And then come here.
Is anybody?
Why has she unmuted us? She keeps unmuting us.
Okay, I will. You again. Does anybody have questions that they would like to ask over the audio version? Okay. All right, folks. Well, we are available after this webinar too, and we will make sure to send out the power. We'll be sending out a recording, and we also will be sending out the slides too. So yeah, you can all log off if you are. Oh. What are the ages you can serve? Oh, that's a good question. Actually, Leah, would you like to?
Yeah, that's a great question. So we serve pretty much anyone who wants to come to us for care. If you are a minor, you can go to any health clinic, including Planned Parenthood, to receive basic preventive care. If you're a minor, you can come to us for your birth control needs and any of the other health services that I mentioned. I will say, though, that Minnesota law does require that if you're a minor and you are seeking an abortion, that Minnesota law does require that both parents are notified of that, and there's some rules around that. So that is sort of the exception, but you can come to us for basic care. I will say, though, that if you're under 18, well, let me say this. The majority of our patients, the vast majority, are between the ages of 20 and 30. And there's also a high percentage of folks between the ages of 18 and 19. So we don't serve, I think we serve about 6% of of our patients are under the age of 18. So it's not a huge chunk, but those folks can come to us for care.
Great. Let's see here. We got some more questions being typed in. So great. I think this person's asking, if Title X is like funding services, are they then free of cost?
Yes, so this is Leah. So depending on your income, yes, generally it's free. So what happens is that the entities that receive the Title X funds, so again in Minnesota, that's Planned Parenthood and our delegate agencies, as well as Ramsey County Public Health, what that does is it allows us to have a sliding scale fee for the services that are eligible under Title X. And again, those are all the preventive services. And so if you are low income and you come to us for care and you're eligible to receive Title X, you can receive those services for free or like extremely low cost, but primarily, yes, it's free.
Okay. And do you serve teen males?
Yes, we serve anybody. Yep. And I will say that we are seeing more and more young men. Every year, the percentage of of young men and men in general that we see goes up. So right now, it's about 12% of our patient load, and that again is increasing. Our St. Paul clinic also does do vasectomies, just as an aside. So we are a comprehensive reproductive health care provider, and we are providing all of that care. I will say most of young men, when they come to us for care, they are coming for STD testing and treatment, HIV testing and treatment, and to get condoms. So that's generally the care that they are coming to us for. But yep, we do serve men, and thank you for that question.
Yeah. Are there income restrictions for folks to use your services?
So the answer is yes and no. So we accept all forms of insurance, and including Medicaid, which is the public health insurance program for low-income Americans. So we accept all forms of insurance. Depending on your income, if you meet the income standards as outlined by Title X, you could come to us and receive, because you're eligible for Title X, receive those services at no cost.
Okay.
So yes, it does depend on if you don't have insurance that would cover your visit, or you have a high deductible, and then if you're low income, yes, we can slide the cost of your care.
Okay. Where do folks find the clinics that are covered under Title X?
You can look at the map that was in the slides that will be coming out. But as far as Planned Parenthood is concerned, if there is a Planned Parenthood clinic in your area, with the exception of our St. Paul Vandalia location, all of those clinics serve Title X patients. And then the map that was included in the PowerPoint shows the other are like what we call our delegate agencies. And again, that was the Winona location for SEMCAC, Southwestern Minnesota clinics, and kind of North and Central Minnesota clinics. Well, that will be coming in the webinar slides.
Yeah. All right. I think that's all folks have typed in. Certainly, you can type it in now, or you could use the audio. Like we said before, we are available for questions. If you're needing, more specific guidance around these action steps, or you have further questions about Title X or the gag rule, or about finding services in your community, please feel free to reach out to us. Like I said before, we will be sending out the PowerPoint along with the recorded webinar too. So yeah, well, thank you everybody for joining us today. As we've highlighted here, this is a really, really important issue. We hope that you feel more prepared after this to take action and more educated about what Title X is and how it benefits and how the gag rule can be detrimental to the folks that you're serving and to your community. So yeah, we can go ahead and we'll say goodbye for now, but like I said, feel free to reach out to us. So thank you very much.